Assalamu alaikum friends, here you are with Sayyida OMAMA SHAH, and today we will be discussing anemia and its classification. In this video I will be giving a general overview on the anemia while it will be discussed in more detail in our next lectures. So without delay, let's begin our today's video. Now what an anemia is? The most general and acceptable definition is whenever there is low level of hemoglobin in a person according to age and sex, then that person will be called as anemic. Now the normal ranges in adult male is between 14 to 16 gram per deciliter. In female, the normal level of hemoglobin is between 12 to 14 gram per deciliter, while in newborn it is between 18 to 22 gram per deciliter. Now coming onward towards classification of anemia. So anemia is broadly classified as etiological classification and morphological classification. In etiological classification, we study the causes that causes the anemia, while in morphological classification, the anemia is because of the change in shape and form of red blood cell, and it causes the person anemic. So broadly, anemia is classified into two. One is etiological classification, while the other is morphological classification. Now the first one we are going to discuss is etiological classification. So in etiological classification, some factors and causes that due to which the person becomes anemic, we will study that causes and factors. So the first factor is decreased red blood cell production. So whenever there is decreased or reduced red blood cell production, so the person will ultimately be anemic. So decreased red blood cell production is one of the factor or causes that cause the person anemic. The second one is increased demand or utilization. Whenever there is increased demand in the body, or whenever there is increased utilization of the red blood cell, then that person also becomes anemic. So etiological classification, one is because of either a decreased red blood cell production, or other it may be the red blood cell may be utilized more, or the demand is very much high. So these two factors basically causes the person anemic. Now the first one is the increased demand or utilization. So in increased demand or utilization, the body demand for the red blood cell will be high, or there will be increased utilization of the red blood cell. So if we move on toward its classification, so one is the blood loss and one is the hemolysis. So in blood loss, there maybe because of some injury or because of some surgery, there will be blood loss, and due to blood loss, the body demand for red blood cell will be high. So one case is the blood loss and the other case is the hemolysis, which is red blood cell destruction. So increased demand or utilization is further classified into blood loss and hemolysis. First we are going to discuss the blood loss, in which the blood is losing from the body. So one is because of chronic blood loss, and the other is acute. In the chronic, as you guys already know, that it develops in a longer time, and it cures also in a longer time, means it takes more time to be cured. And in acute, the trauma, for example, the trauma means the disease develops very suddenly and it cures also in a lesser time. So the diseases which occur suddenly and cures in a lesser time, it comes in the category of acute, while the diseases which take more time to develop and which take more time to be cured, these diseases come in the category of chronic diseases. So here in blood loss, the chronic diseases are hemorrhage, hemorrhoids, and hematuria. These three will be discussed in more detail in our next video. First, I'm going to give a general overview on the anemia. Now if we move on towards acute, so we have major trauma and major surgery. Whenever there is accident, so in accident there is also blood loss, and that blood loss comes in the category of acute blood loss. Now moving onward towards hemolysis, so one is immune hemolytic anemia and the other is non-immune hemolytic anemia. Means that in immune hemolytic anemia, the immune system is involved in the destruction of red blood cell, while in non-immune hemolytic anemia, there is no involvement of antibodies or immune system in the red blood cell destruction. So if we talk about the immune hemolytic anemia, so it is further classified into three. One is autoimmune hemolytic anemia, the other one is alloimmune hemolytic anemia, while the third one is the drug-induced hemolytic anemia. This autoimmune hemolytic anemia is of two types. One is warm type and the other is cold type. In warm type, basically there are antibodies that are responsible to destroy the red blood cell whenever the temperature is 37 centigrade, while in cold type, when the temperature is low, so then in cold type the antibodies, some specific antibodies are responsible to destroy the red blood cells. Now we have non-immune hemolytic anemia, which may be hereditary or it may be acquired, means it may be transferred through inheritance or it may be acquired through life, through different means in physical life. Now if we talk about the hereditary, so further it is classified into membranopathy, enzymopathy and hemoglobinopathy. Now in membranopathy, the examples include they may be hereditary spherocytosis or hereditary eleptocytosis, as the word membranopathy indicates that there will be defect in membrane or shape of red blood cell. So hereditary spherocytosis and hereditary eleptocytosis are the two examples that comes in the category of a membranopathy. The other one is enzymopathy. So the examples in enzymopathy include glucose 6-phosphate dehydrogenase deficiency and pyruvate kinase deficiency. So these two enzymes are responsible for a red blood cell. If there is deficiency of these two types of enzymes, then there will be a defect called as enzymopathy. Which two enzymes? I will repeat once again: glucose 6-phosphate dehydrogenase and pyruvate kinase. Okay, moving on towards hemoglobinopathy. So hemoglobinopathy is further classified into three. One is quantitative, the other one is qualitative, and the third one is co-inheritance. So in quantitative, the example is thalassemia. In quantitative, we discuss the quantity of red blood cell. So the example is thalassemia, and thalassemia is basically an inherited blood disorder that causes body to have less hemoglobin than a normal. And in qualitative, we have hemoglobin S, means whenever and hemoglobin C, hemoglobin D and hemoglobin E. These are some of the examples in qualitative hemoglobin in qualitative anemia. Okay, now moving on toward in co-inheritance. So in co-inheritance, they are the combination of quantitative and qualitative anemia. So the example may be qualitative plus quantitative. For example, hemoglobin S, you take hemoglobin S and thalassemia, combine it with thalassemia, or hemoglobin C, combine it with thalassemia, hemoglobin D, combine it with thalassemia. So these are all the examples of co-inheritance. Means co-inheritance. In co-inheritance, the defect is the addition of both quantitative and qualitative. In other words, I will explain it like this: that when the quantitative disease, when it is combined or it is aided with a qualitative disease, so it forms co-inheritance. Now moving onward towards acquired. So in acquired, we have physical, chemical, infection and membrane defect. So in physical, the anemia may be the example include microangiopathic hemolytic anemia, MAHA, microangiopathic hemolytic anemia, MAHA. So this MAHA is the example of a physical anemia, right, and which is a classification of acquired non-immune hemolytic anemia. Now in chemical, the example include lead toxicity. Okay, in infection, the example include malarial parasite, while in membrane defect, PNH, paroxysmal nocturnal hemoglobinuria is the example. Now we have decreased red blood cell production, and this is the second branch of etiological classification. We studied in etiological classification is divided into two. One is that the anemia may be caused of because of increased demand or utilization of red blood cell, or it may be because of decreased red blood cell production. So we covered up the increased demand or utilization of red blood cell. Now we are moving onwards towards decreased red blood cell production. So in the red blood cell, when the red blood cell production is decreased, it will also lead to anemia. Now what are the factors that will lead to decreased red blood cell production? The first one is the bone marrow failure. Whenever there is bone marrow failure, there will be less production of red blood cell. The second one is nutritional deficiency. Whenever there arises any nutritional deficiency, it will lead to decreased production of red blood cell. And number third one is the bone marrow infiltration. For example, if any foreign particle invade the bone marrow and their quantity in that bone marrow increases as compared to the normal cells that are responsible for red blood cell formation, then it will lead to bone marrow infiltration. For example, some cancers will infiltrate the bone marrow, and we will discuss this later. Now moving first, we are going to discuss the bone marrow failure. So the bone marrow failure will be maybe generalized, or it may be isolated, and in generalized the examples include pancytopenia and anaplastic anemia. As pancytopenia is a little bit complicated, so it's a condition in which there is lower than normal number of red blood cell, white blood cell and platelets, right? So as this is generalized, so all the three lines of red blood cell production are affected. Now in isolated, the examples include pure red cell aplasia, and this pure red cell aplasia, also called as PRCA, it is a rare bone marrow disorder, and it is characterized by decline in the red blood cell production. So here only the red blood cells are produced in a lesser quantity, so the red blood cell production is declined. Now nutritional deficiency examples include iron deficiency anemia. So in iron deficiency anemia, the iron is deficient and it will lead to anemia. Megaloblastic anemia, it may be because of deficiency in the vitamin B12. And pernicious anemia, basically in diet the vitamin B12 is in diet, vitamin B12 is taken, but due to absence of intrinsic factor which is responsible to absorb the vitamin B12, there arises anemia, and that anemia is called as the pernicious anemia. So the main reason in pernicious anemia is the absence of the intrinsic factor, right? Now anemia, chronic disease and copper deficiency disease are some of the nutritional deficiency that leads a person to become anemic. Now bone marrow infiltration include leukemia, which is mostly the generalized generally the leukemia refers to cancer of white blood cell. Lymphoma is the cancer that begins in lymphocytes, while myeloma is a cancer that arises in the plasma cells, that develops in the plasma cells. So this was all about the decreased red blood cell production. Now we have morphological classification, which is the second classification of anemia. So morphologically, we have normochromic and normocytic anemia, microcytic and hypochromic anemia, and macrocytic and normochromic anemia. Now we are going to discuss one by one each of them in detail in our next slides. Number first one is the normochromic and normocytic anemia. As the name indicates, normochromic means it is of normal color, means the hemoglobin concentration is normal, and normocytic means that the size of the red blood cell is also normal, but the anemia is because of result of other diseases. Examples include aplastic anemia and hemolytic anemia. Now the second one is the microcytic and hypochromic anemia. As the name micro indicates small, so in this the red blood cell will be smaller in size, and in smaller size red blood cell there will be lesser quantity of hemoglobin. Hypo means less and chromic means color, so the concentration of hemoglobin will be lesser in the red blood cell. The examples include iron deficiency anemia, thalassemia syndrome, anemia of chronic disease, and sideroblastic anemia. Now, if I talk about the sideroblastic anemia, so it can be hereditary or acquired. And in hereditary, there is basically a defect in a gene, and that a defect in the gene arises because of the absence of enzymes. And because of that absence of enzyme, the protoporphyrin 9 is then unable to absorb iron, or you may see ferrous iron. So, in short, I will see that in sideroblastic anemia, the iron inside the red blood cell is inadequately used to make hemoglobin, and despite the normal amount of iron. Number third one is the macrocytic and normochromic anemia, means the red blood cell size will be enlarged or larger, and the concentration of hemoglobin will be normal. So in this, the macrocytic normochromic anemia may be oval macrocytic anemia or round macrocytic anemia. In oval macrocytic anemia, the example is megaloblastic anemia, and this is the anemia that arises because of either B12 deficiency, folate deficiency, or intrinsic factor deficiency. While in a round macrocytic anemia, which is also called as the non-megaloblastic macrocytosis, and they arises whenever there is a problem with the liver, spleen, or bone marrow. Finally, thanks for watching. Allah Hafiz for now.